Orla, thank you so much for coming today. I'm so excited to have you. We've been trying to organise this, I want to say, for probably 2 years at this stage. And just both of us, busy lives, we're finally getting sat down and having a good chat about women's health. So, Orla, you're a doctor, specialist gynaecologist, a promoter of women's health, an educator. And I always love how outspoken you are about women's health. And that was the idea of asking you here today. There's so much I'd love to talk to you about, but obviously we've not got all day. So the main things I'd love to chat about today is the perimenopause and the menopause. So in your words, what is happening? What is the menopause?
Well, Joanna, and thank you so much for having me too. As you said, we've been trying to get this organised for a few years now, and just with being so busy and different commitments, but it's just a brilliant opportunity, to share our own experiences with clients and patients, as well as to educate women, about all things women's health. I suppose in relation to your question about the menopause, I always go back to what the menopause was called in the past, the change, and that's what it is. It's a massive change in a woman's life, and a lot of women do feel that they're just searching for their former self. They just don't feel themselves, and there are so many symptoms. The average age of the menopause is 51, so on average we say that 51% of women have the menopause at 51. Premature menopause happens below the age of 40, and there's about 1% of women having premature menopause, but and some women are still having their periods in their late 50s. So, but on average, perimenopause starts mid to late 40s, and perimenopause starts mid to late 30s, and menopause starts mid to late 40s.
So there's no set rule with this. Everybody's different.
No, everybody's different.
I think the biggest thing that shocked me, whenever we set the date, I started doing research and looking into it. And the biggest thing that I think surprised me is the vast list of signs and symptoms that women have, from fatigue to muscle ache to anxiety and even depression. It's so varied, and it's upsetting to think that women that will go through all that and they don't understand what is happening to their bodies. But the question is then, I was wondering, is when is the right time to go and seek help? Is it as soon as you start to notice symptoms, or do you wait until it's affecting your day-to-day lifestyle?
Yes, that's a very good question, because a lot of people don't know what to do or don't know where to turn. And I suppose one of the challenges is that it's even to recognize the symptoms, because as you say, some of it can be depression, and then some women may not even realize that it is the menopause. It's like putting the jigsaw puzzle together. It's just that light bulb moment to think, hold on a minute, could this be perimenopause, even though I'm only mid-30s? So it is really difficult, but I suppose what I would say to women in general is, you know your own body and you need to trust your instincts. And if you feel that something's not right, well then that's the time to go to seek help. And it doesn't always mean that you have hot flushes or night sweats. As you said, there's so many different symptoms. But if you feel, a change in whether even sleep can be massive, because we know that in the menopause and perimenopause, you can have, it's like an agitated sleep. It's really hard to get to sleep, and then you may waken up early, and even your quality of sleep isn't a deep sleep.
And which is hard. It's so hard to function during the day if you've not had a good night's sleep.
Absolutely. So even things like that, it doesn't mean you're waking up with hot flushes, but it means that your body's changing. And as you say, that would make you depressed. You're absolutely exhausted. You lose your motivation. So even things like that.
And then
really
that would
important.
be a knock on. That would then affect, if you're depressed, if you're not sleeping, how you function throughout the day, which would affect how you respond to when you're at work with your children, your husband, which then must also affect marriages, which must be incredibly hard. So then I started looking into, when do you go and see the doctor? What do you do? So there's supplements as well, but you go into a health shop or a pharmacy and there's a tablet for everything. Where do you start? What do you take? You could take 20 tablets a day and it could cost you a fortune. And how do you actually know which one is benefiting you? What would be your advice on that?
Well, certainly I'm a believer in the holistic approach. But again, that's a really good question, because when you go on social media or when you go into a health shop or pharmacy, as you say, there's a tablet for everything. And it's really, really hard to know, should I be on this or that, and should I try this? I certainly do feel that some supplements can be very valuable, but I think you have to ask yourself, why you're taking it, because the reality is, in relation to these supplements, a lot of them are based on estrogen, and whether they're plant estrogen or they have an estrogenic quality, meaning that they act like estrogen. So that's what you're lacking with the perimenopause and menopause. So that's where HRT comes in, because now HRT isn't for everybody, but a lot of those supplements for all these different things, whether it's your bone, whether it's your brain fog, whether it's the vaginal dryness, whether it's to do with even helping with bleeding or periods, HRT is the answer to all of that. So I think
sorry to interrupt you, whenever I have done the research or spoken to women about HRT, it seems to be quite controversial. Would you find that?
Yes, that's true, because again, well, first of all, in the past there was a few big studies, and it was completely sensationalized in relation to the risks of HRT. And then there was a generation, it was like my mum's generation, say 20 years ago, then everybody was taken off HRT. So there is that overwhelming still fear about breast cancer risk. But the reality is, with breast cancer risk, for example, if we just take that as one example, yes, over a period of time, there is a very small incremental risk in breast cancer. But there's actually a higher risk if you take a moderate amount of alcohol.
Yes.
And lots of women are actually turning to alcohol if they're not on HRT, even to get through their daily lives. It's maybe a Chardonnay in the afternoon or whatever. And that can also have serious consequences. But it doesn't say in the media, if you drink a moderate amount of alcohol, you're going to get breast cancer. So we have to really think about all the risks associated. Of course, sometimes breast cancer runs in families. And even if your mum or sister has breast cancer, that doesn't mean you can't take HRT. Okay. Because even if you look at the women with breast cancer, so many of them aren't on HRT. So you have to think about other risks. Obesity is another big risk for breast cancer too. And the challenge with the menopause is it's very common to put weight on. So I would try to reassure women in the risks of HRT, but also to tell them the benefits.
Yes, so we don't need to be afraid. I think the best thing to do is go and speak to a specialist like yourself.
Absolutely.
So the menopause is linked to so many things. Every cell and organ in the body is affected by estrogen. From my perspective, I would see a lot of patients coming in from early 40s onwards, noticing changes in their face with the aging process. And it's linked to perimenopause and the menopause. And for me, it's trying to explain to the patients that what they're going through is normal. And they will come in complaining. I will have ladies in their 50s and they feel like their face has changed overnight. And it's the quality of the skin, wrinkles, they'll notice a heaviness of the lower face, crepiness, their fat pads and bone structures changing. So it is then having a knock-on effect and changing their appearance. And women really struggle with this. But I think being more outspoken about what is actually happening to our bodies, and women understanding this and understanding that it is normal. And of course, there's treatments that I can offer to help slow down the aging process and improve, but also from a holistic lifestyle point of view, it's brilliant to see women like yourself promoting living a healthy lifestyle. Is there anything else that we can be doing, even from a younger age, to help promote long-term health and slow down all these signs and symptoms that comes with the menopause?
Well, that's a really good question, because as you say, we all just look in the mirror and we all see your wrinkles, we all see the sagginess, and unfortunately it is directly related to estrogen, as you say. And even in relation to the bone structure, we've thinning of the bones in our skull. So if your skull's getting smaller and your face is getting smaller, the skin attached and the fat pads and everything, they're going to be saggier. So I suppose it's really looking at in relation to other parts of your body and the impact on that, as you know, as what I've just said, I'm a really strong advocate for HRT, and HRT taken at an earlier age can be very beneficial, not just even in relation to your skin, but also in relation to other parts of your body. For example, I was going to say start with the vagina, but
well, that's it. I'm talking about the face, but it isn't just the face.
Yeah, absolutely.
It's aging.
Absolutely. So if you transfer that to the vagina, because the vagina is no exception, because like the skull, the pelvic bones are reducing, the muscles in the vagina are getting weaker, and it's all to do with even collagen and your ligaments that support the muscles. So you're much higher risk of getting prolapse. You're much higher risk of having urinary tract infections. The vagina even can just fuse away and disappear, because the labia, which we would call the lips of the vagina, I mean, they get cracked, they get dry. So, I mean, a lot of women don't even associate this with the menopause. And I mean, if you had cracked lips on your face, the first thing you do is you moisturize. People have cracked vaginas for years and they don't do anything about it. So, you know, that is a big, big issue. Yeah. And so the earlier, I think, now, of course, I wouldn't be prescribing estrogen to somebody who didn't need it. And it is, I mean, some of the other symptoms coming into your late 30s could be from other conditions like thyroid issues or vitamin B12 deficiency. But you do have to think, you know, for the long-term health. But it's not even just the skin, it's also your bones. So you're much higher risk if you have an early menopause, particularly of osteoporosis. And also, believe it or not, your cardiovascular risk.
Yes.
And this is really, really important, because heart disease and stroke is one of the highest causes of death in women. And even in relation to, you know, looking after your body, because everything changes in the menopause, that's where this risk comes in. So when the menopause hits, you're much higher risk of having high cholesterol, and that causes the plaques in your blood vessels. So that causes a heart attack or causes a stroke. So believe it or not, HRT actually reduces that risk, because estrogen helps the blood vessels, helps the elasticity. It's like the elasticity of the skin. It helps the elasticity even in your blood vessels.
Yes.
So that's another reason why you should consider HRT at an early age, because it actually protects you against heart disease and stroke.
But just going back to, that's why I love talking to you, Orla, because you're always so open about female issues. But for many women, talking about those problems about their vagina, it's difficult, it's hard. Yeah. And I think it's amazing to hear people like yourselves talking about it more and making it not so taboo. And if they feel they're having problems, go and speak to somebody. And there's so many people out there that they can talk to. There's another side of it as well that you'll see. I've noticed a change in where you see a lot of younger girls now in the gym working on strength, and it's great to see. And of course, the menopause does bring big changes with muscle mass and our bone density. So would you be a promoter of starting young, working on strength to give yourself a healthier lifestyle as you age?
Absolutely. And it's brilliant now that people are thinking that way. And I mean, years ago, you know, people helped older women carry things, even like if you think about your groceries in the supermarket, you know, and even sometimes I would have some of the staff would say, do you need a hand with those bags? Because even simple things like that, carrying the bags. Now, of course, there can be other reasons why people can't carry bags. And even in relation to the vagina, if you have a prolapse, heavy lifting, that can be an issue. But it's really, really important, you know, at a young age to get the muscles as strong as possible, because it's just wipeout time when it comes to menopause. And then, you know, if you have a really good sense of muscle strength at a young age before all this hits in, then you have a much better chance of, you know, having a normal life, being able to do exercise into your 80s and 90s. Yeah. And then that reduces your risk of having a fall, and then that reduces your risk in older age of having a fracture, because if you fracture your hip in your 70s or 80s, the chances are you could potentially die of that, because you could get a really bad pneumonia, you know. So those sort of things, it's so important. So it's like an investment in your future health.
Yeah. The thing I struggle with personally from my perspective, I'm 42 now, I'm a mother of 2 children. I have a busy life with work and home. And I have definitely noticed I don't have the same energy I had 5 years ago. But I also appreciate how I need to be exercising, I need to be lifting the weights, I need to be eating healthy. But sometimes it's a balance, because I do get fatigued, I get tired, and it's continuously having that motivation. It's hard for every woman, and we're all doing the same. But I think we touched on this earlier before we started this, about women prioritizing and making time for themselves and how important it is. And no matter how busy life is, we do need to make time to do whatever makes us relax and feel better about ourselves. Would you agree?
Oh, absolutely. And, I use the analogy of the sandwich generation, because we are sandwiched between looking after kids. Well, especially, I'm older than you, so, my kids have left the nest now, but, that perimenopausal stage, you're looking after your kids, you're looking after maybe sick parents, you're trying to balance everything. And it's like, as Jerry Hall said, you have to be the wonderful chef in the kitchen, and then the sex queen in the bedroom, plus be the best mother that you could ever be, the best daughter, the best friend. So, you have to be realistic. And I think we do put too much pressure on ourselves.
Huge amount of pressure. I would notice that definitely with patients coming in. They're so hard on themselves, so critical of themselves. And I'm looking at these amazing women coming in and trying to say, don't be so hard on yourself, and also I think we need to understand this is happening to all of us. Every other 42-year-old woman like myself Absolutely. Is seeing these changes, and every 50-year-old woman is seeing changes, and it is all normal. But yeah, it is all very interesting. And of course, then the other side of it is, as well as exercise, diet, alcohol plays a huge part in our lifestyle, and trying to live a balanced life is really important as well.
Yes, that's true. And I think even getting back to what you said of having time for yourself, you have to find a place that, whether it's a place in your head or a physical place, that you need to spend time for yourself. Yeah. And, there's a lot of talk now about mindfulness, and that's so important, because you need that time for your own space, because, that's your survival, and it's almost like you need to have it on prescription, that you're not taking, if you're taking, you take it every day or at a certain time or 3 days a week or whatever, because you have to prioritize that, because, something will give.
You'll burn out.
Absolutely. Yeah. Absolutely. Yeah. Definitely. So it's really, really important. But, I think the more we talk about it, then the more we get that message across.
Yeah. Yeah. And in regards to relationships, I'm sure the menopause can definitely affect relationships with sexual intercourse, getting time together, communicating together. Is there any advice you can give to people that might not even realise they're starting to have problems in their relationship because they don't get time to communicate, or they might be very aware that they are starting to have problems? Is there any advice you can give for people that maybe are starting to struggle?
Yes, and that's, again, we're not very comfortable about talking about that. And the reality is, once menopause hits, your vagina changes. And as I said earlier, it can get narrow, it can get much tighter, it can be very painful, it can be really dry. And then the other thing is, because the urethra, which is where you pass urine, is affected by the low hormone as well, then you get cystitis. It's like honeymoon cystitis, as they used to call it. Even you get kidney infections after intercourse. So it's really important to recognize that is a symptom. And vaginal estrogen, I have women even in their 90s on vaginal estrogen, not necessarily for sexual performance, but for the health of the vagina. It helps the muscles, it helps the ligaments, it helps the bony pelvis. So it's really, really important, because the other thing is, an intimate relationship is such an important part of a relationship. And when that goes, the whole relationship dynamic changes.
Yeah.
So, that's a big factor, even in relation to the physical changes. But then we also have to remember that the ovaries also produce testosterone. And testosterone is a hormone that gives us our oomph, gives us our get up and go, gives us our libido. And actually, the definition of libido is your lust for life. So it's not just lust for sex, it's lust for life. And I do feel in the menopause, we do just sort of go into ourselves. just can't be bothered. You lose your mojo. So testosterone can be very, very useful as well for management of low libido. Now, it is licensed for, so you have to be really careful when it comes to medication, that they're tried and tested, and there's been thousands and thousands and thousands of women that have been researched. So at the minute, it has been clinically proven that testosterone can help libido. And basically, you can get it in a gel form or a cream. You just rub a little bit on your skin, and I know that it does make a big, big difference. But also we know that testosterone in general, particularly in relation to men, it's good for your muscles, it's good for your bones. And it is, we think that it can help tiredness, and I've seen that in my own practice, but I can't say that it's licensed for that use or licensed for your mojo, because there isn't the studies to back that up as yet. But I can see in my own patients that it just gives you a wee bit of oomph.
So any couples that maybe are finding that they are having difficulties in any part of their relationship, do you think they need to maybe go and speak to somebody? Is there therapists out there available for that? Or is it a case of just communicating between themselves?
Well, I think the first thing is to talk about it together, because a lot of couples, women then maybe feel embarrassed. And the other thing is, I suppose too, that, if you have put on a little bit of weight, there's a body image thing. And never mind, as you said, the time.
Women are so hard on themselves. It is very hard seeing your body changing and not having much control over your body.
Absolutely. And you see, even the dynamics in a household, if you have teenage kids, you don't want to make any noise in the bedroom. And my kids are now going to be so embarrassed with this podcast, as are yours. But what I'm saying is, you need to talk to each other, because the other thing is, a lot of men can have issues as they get older too, with prostate and erectile dysfunction. Now, and some women would say to me, it's actually quite a relief when that happens, because they don't feel as much under pressure to have sex. But so I think there are so many easy, like vaginal estrogen is a life changer in relation to the vagina. It's amazing. And even some things like in general, with even just using a lubricant, because even of the dryness, as I say, if you've chapped lips, you put on a moisturizer. There's some really, really good vaginal moisturizers and vaginal lubricants. Now, I would usually recommend an oil-based one, because the oil-based has a little bit of moisture too. The water-based ones are just based, they don't give that added moisture. So, there are some women who perhaps feel uncomfortable with taking vaginal estrogen, but even if you have suffered from breast cancer yourself, you can still take vaginal estrogen. Okay. So there's really no women that can't take it unless you can't actually put it in yourself.
And are these options that can be prescribed by a GP, or do they need to see a specialist like yourself?
No, a GP can prescribe vaginal estrogen, and there's no problem with getting a prescription. Now, there are some campaigns, worldwide, and this could be a chat for another day, in that vaginal estrogen, because it is such a low dose, should be considered perhaps that you don't need a prescription for, because if you compare it to the likes of Viagra, you now don't need a prescription for that. Right. So it's like a male equivalent, but certainly at the moment you still need a prescription. But the first port of call is, of course, your GP.
Your GP, and then they could refer you on
if you need it to be. But a GP can, and is very, very experienced. So many GPs are very experienced in menopause care, and they will certainly can prescribe vaginal estrogen. And also in GP practices, they're also very experienced advanced nurse practitioners too. And say, for example, even going to have a cervical smear, that could be an opportunity to discuss it, because even one of the things that having a cervical smear as you get older can be horrendous. Okay. It can be horrific compared to when you're younger, for all those reasons. It's like having intercourse. The vagina is narrower, it's drier, it's much more difficult for the healthcare professional to see the cervix. So even when you have your smear, that could be an opportunity to talk about.
But going for a smear is essential. It's so important.
Absolutely.
As well as checking our breasts.
Absolutely.
And I suppose if you did start HRT, your GP or your specialist they would monitor it, I imagine, the amounts you're taking, and also encourage checking yourselves and looking after our own bodies.
Yes, definitely. That's really important. the cervical screening program has saved thousands of women's lives, and checking your breasts yourself, and the mammography service is also fantastic. So it's really, really important to do that.
Yeah. So another thing I was hoping to touch on is, I suppose, the younger generation as well, that might not be starting perimenopause and menopause, but they are seeing changes. Hormones do affect so much. I would get girls in their early 20s and they've never had acne and they're coming in with acne, and it just, hormones are affect so much of the body. Would you have any opinions on the pill? Would that affect you later on in life if you were taking the pill for a period of time? Does it affect your hormones? And then will that result in signs and symptoms later on in life?
Well, that's a really good question, because going back to what we were talking earlier about information that's available for young women, I do think there is a negativity towards the pill at the moment. And again, now I can understand as well, because some women, the pill doesn't agree with them. And some women feel as well, even from a responsibility for contraception, that it should be as much the male responsibility as the female, because the pill can cause side effects, and particularly in relation to mood. And some women are really, really intolerant, particularly to progesterone. And if you go back to your biology class and you remember the graph with the menstrual cycle, it's after the mid-cycle where you ovulate, where you produce the egg, progesterone goes up. So progesterone is largely associated with all the premenstrual symptoms. So, and some women kind of really severe PMS, and some women have the PMDD, which is the premenstrual dysphoric disorder. Now, I have a particular interest in PMDD, and it from the first age group, even going through school, you know, coping with school premenstrually, it can be absolutely horrific. And some women are actually admitted to psychiatric hospitals with severe PMDD, and once they have their period, they get the 2 weeks that they're really good. So, you know, from what you were saying about hormones, the hormones can have a catastrophic, massive impact in women.
I didn't realise it could be that severe.
Absolutely. I mean, some women commit suicide during that time. That's how bad it can be. So, but I do feel, though, the pill has got quite bad press, and it's by influencers and by people who don't really understand how it works. And I feel myself that the pill can be a lifesaver for so many young women, not just because it is a contraceptive, but because it can have a massive impact on, for example, endometriosis. Now, I know that there's some women with endometriosis and it doesn't respond to the pill, but there are some women that it can be life-changing. Even young girls doing their exams. I mean, if you're sitting doing your A-levels or GCSEs and you're having an absolutely horrendous period and you're hemorrhaging and you're in agony, you know, you're at such a disadvantage. Yeah. So from that perspective,
it seems so unfair.
Yeah, it is. It's horrendous. Yeah. It really is. And you see, a lot of the time too, they've never been diagnosed with anything. And, you know, it's like being smothered with their periods. It has a massive impact. Now, and what about even when they would play sport? Like so many young girls, then, if they're having their period, that's horrendous. So the pill can be very beneficial even for things like that.
And can we look at our own mothers as to how they have gone through life? Would that then be an indication to how we will cope with things with our hormones, with periods? Is it very similar, or can it be not linked at all?
It can be similar, but as I say to women too, just because your mum maybe didn't have a bad menopause or whatever, the other thing is a lot of women in the previous generation were very good at hiding.
Yes.
And very good at putting the mask on, and they suffered in silence. And the other thing is, in the past, a lot of women, the reality is without HRT, you just turn into a wee old woman overnight, you know, in the previous generations. But I think as well that you also have to remember, sometimes you take after your dad's side and sometimes you take after maybe his mother or his sisters. So it doesn't always run down the maternal line. Yeah. It's a bit like breast cancer risk, even like the breast cancer genes and everything. It can come from your father. It doesn't always have to come from your mother.
Yeah, I think there's two things I want to touch on there. That it might be linked, but also the generation before us didn't speak about things a lot. They hid a lot and didn't talk, whereas now we're coming to the other side of things where we do talk about things a lot more. And now there is also, you touched on this earlier, there's social media now, which I think social media is incredible, but you can get an awful lot of mixed messages and advice that isn't maybe the best advice from influencers, which is hard for, particularly for younger girls, seeing these and listening and taking it on. So I suppose it's important as well for everybody when they're looking at social media, realising it isn't always fact.
Absolutely. And you see, when you're a healthcare professional, you're governed by so many
Yes.
bodies that you have to be objective and you have to make sure that everything is evidence-based. And that's what I'm even saying in relation to the testosterone. I'd love to go out and say, yes, take it for everything. It cures everything. And I know it does have so many benefits, but there isn't the evidence. So I can't stand up because I'm a member of different organizations that, you know, we even take an oath as a doctor that you do your best for the patient. So you do have to be really careful with influencers because you also don't know even what financial benefit that they're going to get. Are they trying to promote a supplement that they're going to make a lot of money on? So you do have to be careful. And the pill, as I said before, is a lifesaver. We also forget as well that, you know, it's not that long ago that women, particularly in the south of Ireland, did not have any access to contraception. I mean, there's a very famous, you know, if you look up the BBC or RT archives of filming of women who got onto the train in Dublin and went to Belfast to get contraception. So, you know, contraception in Ireland and the North too, in a very conservative democracy, that, you know, you have to think that this was a lifeline for women. And now there's so many young women who are saying, oh no, that's bad, that's wrong. But you have to, again, it's not for everybody, but, you know, history sometimes gives us further information, and it's so important to get the facts and not just go by an influencer.
Yes, yeah. But equally, there is a lot out there on social media and on the internet that there is truth in it, and it's
Absolutely.
good to have all that information out there. And you also see celebrities talking about it a lot more as well. Davina McCall would be a big one for talking about the menopause, and I think that's brilliant to encourage women to be more open about things and to understand what's going on. So it is good that it's changing, I think.
Absolutely, yeah.
So we did have a few questions, Orla.
Oh, great.
So we put it up on our social media asking if anyone had any questions. So I will not be mentioning any names, but I am going to go through those with you now, if that's okay. So I'll just grab those. So the first question was from a female. I'm going to read this how it's written, so hopefully it will make sense. It says, I am bleeding again on combined HRT after a year of no bleeding, and I am perimenopausal. Is this normal?
Well, that's a really good question because it's actually not normal.
Okay.
And the guidelines would suggest that if you are having no period for a year, with being on HRT for a year, and you had bleeding, that could be a sign of something more serious. Now, most of the time, it's nothing. It could be just, maybe she's even, because if she was in the perimenopause, she might have had even a surge of a period. And some women would even to say, you know, it actually felt like a period. I felt premenstrual, I had breast tenderness, I had bloatedness, you know, it felt like a period. And that may be that the HRT has even stimulated a period. But it's really important, especially when she's no bleeding for a year, she would need to go to her GP. Okay. And she would need to be referred for an ultrasound scan to check the lining of the womb. Most likely it is just a little polyp, or it could even be a fibroid. It could be coming from her cervix, but in about 1% of women it can be more serious, and it could be a sign of cancer of the lining of the womb.
Okay, so that's great that she's asked that question.
Yes.
I think that's the thing with all of this, there's no set rules. Everybody's different, everybody's signs and symptoms, but if they're unsure, definitely go and get things checked.
Definitely.
I am a 41-year-old and I'm starting to get muscle aches and forgetful. Is this a sign of perimenopause?
That's a good question, because one of the things actually, when I was chatting there about cardiovascular risk, we didn't talk about brain fog.
Yes.
And there is there is now, we think, evidence to say that HRT may be beneficial in preventing dementia because it has the impact on the vascular dementia, because it has the impact on your brain. But doesn't mean that everybody is brain fog is going to have dementia. But what I would say is that it's really, really common, and definitely a lot of women just feel aches and pains, the brain fog. And it's really, really hard to put into words, because some people will say, look, I never had an issue with remembering numbers or remember people's names. It's happened to me. I remember being somewhere and I knew the person, and it's just that thing, I just couldn't remember their name. And it's really, really peculiar. And that can be an example. That's only a small example. Like, some women have an overwhelming fear of their work now. They can't concentrate at work. And then a lot of women work in a very female environment at work. So if you're in an office and there may be a lot of younger women, and then you're thinking, oh my God, am I losing my head here? I can't remember things. I'm not performing. They've concerns even about keeping their job, or if they're going to make a mistake, and how catastrophic could that be? So definitely brain fog is a sign of perimenopause.
So then at that stage, when do you go and speak to somebody? Or I suppose if it's not affecting your day-to-day life, you don't need to.
Yes.
It's just accepting that things are starting to change.
Yes, well, you see, I suppose you have to think about, is it just brain fog in isolation, or are you having the other symptoms? But if you feel overwhelmed, that it's causing you anxiety, that it's causing you a fear of, like, the things that I talked about, whether it's work or home life or whatever, you do need to get checked. And I suppose the other thing is, you're much more likely to have brain fog if you're exhausted. So are you having hot flushes and night sweats that's waking you at night, or are you having a lack of sleep, which can also be directly related to the menopause? So, there's a link there. And it used to be years ago when I first started working in menopause, which is probably, more than 25 years ago, that people called it the jotter syndrome. Now you could say it's the phone syndrome, that every woman had a wee notebook and they wrote things down, so now we're writing things on our phone, like in lists to memorize, because you forget things. So, but if that's having an impact on your quality of life or ability to work, you definitely need to go to be seen.
Yeah, I suppose it's for the woman recognising herself, right? Yes, actually, I am having all these symptoms and they are affecting me day to day. If you're not getting a good night's sleep, you're not going to perform as well during the day. If you are getting forgetful, if you are getting sore with aches and pains, then maybe it is time to go and see a specialist, and there is options out there to relieve some of these symptoms.
Yes.
So we actually had a question from a male. As a husband, how can I help and support my wife during the menopause?
Well, that's obviously a very brave man to send in a question. And it's so relevant, because...
Lots of holidays.
Exactly. Yes. Jewellery, holidays, handbags, whatever. Just shopping and time with friends. No, but it is a really good question, because a lot of men feel really lost. And we talk about, women not talking about things. Like, men are even sometimes find it more difficult to talk about bodily issues, particularly when it comes to female health. And I suppose all down the generations, there's been humour associated with the menopause, or humour associated with periods. And sometimes we use humour because we're nervous or we can't talk about things. And maybe that's even where it comes from men using humour, because it's maybe just a feeling of, difficulty or discomfort talking about it. But I think talking is the big thing, and recognising, the symptoms.
From the woman talking as well and communicating, I'm feeling these things, I'm agitated, rather than just snapping at a husband, because he won't understand, well, what have I done? What's going on?
Exactly. And sometimes my husband would say, yeah, I've just got sorry written across my forehead because I'm sorry for everything, So, but look, in seriousness, most men are very, very supportive. But I think the talking together about it. But the other thing is, sometimes, as you say, about being snappy or whatever, or tired or whatever, you just, you lose in some ways too. You're less, I suppose, tolerant.
Yes.
You just snap at things. So, but the thing about it is, sometimes the woman doesn't even realize it, maybe, that the man can see it more, or you can actually see that it's cyclical, and the thing about, one thing I never said as well is, in the perimenopause or coming up to the perimenopause, a lot of menstrual issues get an awful lot worse. So you're much more likely to have very heavy periods, which could cause anemia, which again could cause you to be exhausted, which could cause brain fog, that you need to maybe be on iron tablets. Painful periods, the severe PMS, that can happen before the menopause, and before your periods in the perimenopause. And sometimes you get like menopausal type symptoms premenstrually, like the hot flushes and everything.
Yes.
And once your period comes, then you're settled for a few weeks. But it may be the men that actually notice this more than the woman who's going through it. And look, a lot of men, there's a lot of information out there, of course. I think it's giving women space and accepting that they're not becoming a psycho, that this is like normal.
Yeah.
And although we didn't actually talk about, other psychological issues and depression and everything, but I think if you do have a supportive father or partner that can really understand that you do need that time out to yourself, but it's all about balance, because they need their time too. So
yes.
It's having, but it's not, you just sometimes need a break.
Yeah, well, that is a whole different subject as well that I think should be more spoken about, men talking. And it becoming more obvious that men do need to talk as well, because I know that men do struggle to talk, but that is a whole different subject. And does every woman go through the menopause?
Yes, but as I said to you earlier, some women would say, or and maybe the previous generation of warriors that would say, oh, I just had to get through it or whatever. And, some people are very lucky that they're very minimal symptoms, but everybody's going to get thinning of their bones.
Yeah.
Everybody's going to have an increased cardiovascular risk. Everybody's going to have a change in their metabolism, and everybody's going to have a dry vagina, basically.
Yeah.
And you see, even that, and then keep going back about the urinary tract infections and whatever, there's so many women as they get older in their 70s and 80s with recurrent urinary tract infections. And the reality is that can actually be fatal, because a urinary tract infection can cause sepsis in older people. And some women are admitted to hospital with it. And urinary tract infections themselves in older people, in general, men and women, can cause confusion. So imagine just by using, now it's not the only cause of urinary tract infections, but it drastically reduces them by using a tiny little bit of estrogen into the vagina maybe twice a week. So as I said, I have women into their 90s using that, because, it can actually save your life.
That's really scary when you realise how severe it can be.
Yeah.
So the final question we got asked, is there a link with long-term use of the pill in future fertility and then future menopause?
That's a really good question. And getting back to what we're talking about, the pill, I think people have a concern that there's a long-term fertility issue, because if you're on the pill for a long time, it can take a little while for that to sort of get out of your system. Because some women, if you're on the pill, you could end up not having a period maybe for 6 months or a year or whatever. But eventually, you will get your period. In relation to fertility, you see, obviously if you're not having a period, you're not ovulating, so you're not going to get pregnant. So I would say to women, look, if you're planning a pregnancy, you should stop the pill a little bit before you're planning it. Now, but of course it would be their luck to get pregnant within their first month, but that you would need to consider barrier methods like condoms, if you want to have a non-hormonal few months before, getting pregnant, because it can take that little while. But the other thing is, you have to ask yourself, why were you on the pill in the first place?
Yes.
Because the pill can be really protective to fertility in relation to something like endometriosis. So if you're on the pill for painful, heavy periods, that means the endometriosis isn't building up year on year on year, which can be catastrophic for your fertility. Because endometriosis causes all the tissues in the pelvis to stick together. It can block your tubes, which can cause an issue with fertility. So I feel for a lot of women that the pill can actually protect fertility. That's my opinion in relation to the hundreds, thousands of women that I've seen down the years. But then the other thing is, say for example, you're on the pill to regulate your periods, or if you've really bad skin because you've polycystic ovaries.
Yes.
So polycystic ovary women, it's going to take them longer to get back to normal. And it is more difficult for women with polycystic ovaries to get pregnant. So again, you could say, oh, it's a pill, but it's why you're on the pill in the first place. Or was it just for contraception and you'd no problems with periods? Those women, there's not going to be an issue afterwards.
Yeah, there's so much we could talk about.
I know.
I suppose what I want to conclude with, and why I brought you here today, it's just really important for women to know what they're going through, why they're going through it, and actually everybody else is going through it as well, and it's very normal, and that there are amazing people like yourself out there that they can go and talk to and get advice. So Orla, thank you so much for joining us today. Just to finish off, have you got any top tips you can give all the women out there to live a healthy lifestyle?
Well, thanks again, Joanna, for having me. And it's just brilliant. We're just sitting, chatting like friends. And that's what it's about, just getting together with friends to talk about all things women's health. In relation to top tips, yes, of course, I could say, eat healthily, exercise more, take more time to yourself, be mindful. But one of the big things I would say to women is listen to your body. You know when something's not right. And, then that's when you need to ask for help. And whether it's to do with periods in your teens or whether it's to do with issues in your 80s or 90s, listen to your body and follow your intuition, and then take that time, to process it. Because, if you know what's happening within your body, and we all know with having periods from such a young age, how our body works, that's where you start, and that's where your healthy lifestyle, and be kind to yourself.
Yes. And is there options for the younger generation that maybe don't have support at home, maybe don't have parents that they can talk to? Is there someone they can reach out to on their own if they were unsure what's happening, if they needed to talk about periods or they were having pain? Is there someone they can reach out to? Is there a helpline, or is it a case of going making an appointment themselves with their GP?
That's a really good question. And to be honest, I mightn't have all the answers for that. I do think when young women would attend GP's practices for contraception, that's a real opportunity. And you see a lot of the time there's very good experienced family planning nurses that can provide that service. And sometimes it is a bit alien, especially for young girls, to go to their doctor, and even in relation to confidentiality and maybe some family relative or friend works in the practice. Certainly, again, there's a lot of stuff on the internet, but there are a lot of good societies as well, particularly, for example, in relation to polycystic ovaries. There's a very good society online called verity-pcos.org.uk, and it gives a lot of information. And there's the Faculty of Family Planning and Reproductive Health that may be able to give some good guidance. But that is a group of women. Now, schools, of course, too.
Yes.
There's a lot more education in schools.
Yeah.
And sometimes, teachers have to be, have many heads. Or they could be their social worker, they could be their nurse, there could be their doctor, they could be their counsellor, as well as being their teacher
as well.
and being their friend. So sometimes it is good to even approach a teacher or, someone within the school system, or special needs assistant in the classroom. But that group of women, they do rely so much on information from social media, which you say can be very powerful and very good, but at the same time, it's not always correct.
Yeah, it isn't. Orla, thank you so much for coming today. It's been so nice to see you, and hopefully it's been really helpful for everyone who's watching.
Well, thanks again, Joanna, for having me, and I'm really hopeful that even some of these messages will get through, and it's just to give women a much better, improved quality of life.
Absolutely. Thank you.
Thank you too. All the best.